Hello, I'm Samantha OIds Frey, and I'm the CEO of the Illinois Association of Medicaid Health Plans. And you're joining us today on the Illinois Association of Medicaid Health Plans IAMHP's Executive Corner. And today we're going to talk about mental health, as May is Mental Health Awareness Month. And here at IAMHP, we've been passionate about mental health and improving mental health outcomes here in Illinois for quite some time. Why we care so much about mental health is, first of all, it's critical from a physical health component. Health is health at the end of the day. And if you haven't managed your mental health, you're going to see worse outcomes on the physical health side. And we're going to dive into that a bit later. But the other piece of this is to remember that the Medicaid program here in Illinois, but across the nation, is one of the largest payers for mental health treatment. And so what we do within the Medicaid program, how we support our providers, how we empower our members, not only is going to impact those over 2.2 million people who rely on Medicaid managed care organizations, or over 3 million who are within the Medicaid program, but all of Illinoisans, and really from a Medicaid perspective, all of those across our country. Medicaid covers mental health treatment both within a community setting, whether it be a counselor, a licensed clinical social worker, just simple medications, all the way to intensive outpatient treatment, substance use disorder treatment, and residential treatment when necessary and appropriate, and of course, hospitalization. However, at the end of the day, what our hope really is that we are interlinking physical health care and mental health care in an outpatient community-based setting and stabilizing our Medicaid members so that they can meet their goals and meet their needs holistically, and in a manner where we're managing their mental health care and their physical health care in a synchronized manner. And why that's important, as I indicated earlier, is that our mental health absolutely impacts our physical health, whether it's the stigma that an individual receives when seeking physical health care, or the trauma and the stress that untreated mental health can put on our physical body. And what do I mean by that? A person with a serious mental illness, they are 53% more likely to be hospitalized with diabetes, which is absolutely a disease that is managed oftentimes in an outpatient setting with simple medications. However, because of both stigma and because of a lack of ability to adhere to outpatient required medications, we find these individuals more likely to be hospitalized. And that is where the role of care coordination can come in, is helping this member manage their mental health needs and also their physical health needs. And so that is the role of both a clinician, but also of a care coordinator, to help those members advocate for themselves, to get the needs, to get their care needs met, and to improve their healthcare outcomes. At the end of the day, reduce hospitalization, increase adherence to medication. But really, when we look at this holistically, what we're actually doing is improving their well-being and their enjoyment of life. And beyond diabetes, what we also know is people with substance use disorder, within that sort of behavioral health umbrella, they're 9 times of greater risk of congestive heart failure and 12 times the risk of pneumonia. And so that is, again, really approaching the healthcare of these individuals, of these members, holistically. Treating their substance use disorder and managing their physical healthcare needs are absolutely necessary to be done in concert with one another so that we can meet the needs of these members and improve their health outcomes and overall their general well-being. So as we go into May and we're talking about mental health and we're talking about the work that needs to be done, I hope that we all remember that the Medicaid program is a wonderful tool to provide services and safety net for individuals with severe mental illness or any level of mental illness, and that now is the time for tremendous change and investment within this program, and that care coordination and health plans are here to help and improve outcomes of our members across the great state of Illinois. So thank you for your time today. If you're interested in learning more about what IAMHP does, please like and follow us on social media, Facebook, Twitter, and LinkedIn, and do check out our website at imhip.net. Thank you.